to call the Finance Committee meeting to order. Roll call, please.
Markham,
Here.
Middleton,
Here.
Woodward, McGillivray,
Here.
Quarles. Here. Howell.
Here.
Long,
Here.
Colwell. Here. Zach.
Here. We have a quorum. Pledge of Allegiance. I pledge allegiance. With that, I need a motion for the approval of the minutes, please. Commissioner Colwell, supported by Commissioner McGillivray. Any discussion on the minutes? Seeing none, all those in favor, say aye.
Aye.
Anybody opposed, say nay. Motion carries. I need an approval of the agenda, and we need to amend the agenda with this. We have a walk-on item, and so it is the Compliance Office Universal Administration of Procurement Policies and Procedures. So do I have a motion to Commissioner Markham to move the amended agenda with Commissioner Powell? Any discussion about that? All those in favor say aye.
Aye.
Anybody opposed, say nay. Motion carries. Now we have public comment. Commissioner Middleton.
Yes, on my iPad, it comes up, Eileen Colwell invites me due to finance.
What?
Why did we get that message? I got so, I don't.
Did I?
I don't respond to any of those invitations.
So it is the system, we discussed it.
Yeah.
You know, if you are accepting, sometimes it goes into all of us. And what I can't explain why it happens, but what I'm going to advise you, the only time that you would acknowledge those is if it comes from a staff member. Okay? So if it's someone on the committee, just ignore
I
it.
didn't even know I did it, so.
Yeah,
All right.
it's accidental.
It messes it up.
If you click, if
Yeah,
you're putting something in the calendar and then one pops up and it looks just like it, and you click on that so it'll load up, but it really doesn't. It's an old meeting notice that notifies all of us. I've made that mistake like 5 times, so I'm trying not to do that.
I thought we.
I guess I got 4 more times.
So, okay.
So stick to the staff. Treasurer Meisner, would you like to speak now, or you want to wait until the agenda item comes before
Whatever
us?
your preference is, Chair.
Either, whatever your preference is, I defer to you.
Okay,
What?
yeah,
Okay.
okay. Good morning, I'm Andy Meisner, I'm the county treasurer. This morning, the finance committee is walking on a policy that is directed at the investment function in Oakland County. And at the selection of depositories that this ad hoc committee has been looking at, and so I wanted to express a few sentiments about that. First off, just that, we have all worked together for many years, and in order for county government to function properly, there needs to be communication and collaboration amongst partners, especially those of us who were put here by the people of Oakland County in an elected capacity. This morning is the 3rd time that I've been presented a resolution the same day that affects the function of the county treasurer without so much of a courtesy as receiving it in advance, without getting any opportunity to comment. Not only is this, it's unprofessional, and the citizens of Oakland County deserve a lot more from their entire county government. And so if I could beg of you, respectfully, to be adult enough that if you have issues with the way that this government or our department is functioning, that you discuss them with us. I have a very capable team here of very nonpartisan folks who have worked well with Democrats and Republicans over the last 10 years. If there's an issue, state it. But so far, the analysis of this function has reflected several misinterpretations of state law, which I'm happy to correct for you, if you need that. But state law governs the function of my office. I'm a constitutional officer set forth in the Michigan Constitution. And so I can go through and describe that, describe the way that the investment function is assigned to the county treasurer, and I can also correct the misstatements in this resolution about there not being a policy for and an RFP process for the function of placing deposits with depositories around the county. This is the county policy. It's the same county's policy that's been there. And so we coordinate closely with the purchasing division on a number of different functions. The purchasing department has been very helpful in the selection of RFP for treasury management services. But investment functions happen on a daily basis and require a flexibility for the county to be able to not only pay its bills, but to take advantage of investment opportunities. And so I don't know of any county in the state that has the placement of deposits under the RFP policy and under purchasing. We welcome, as I've said every time, any input about any of the functions in our office. I respectfully remind you that our investment policy just won a national award as being best in class. And we just sat around the table, some of us together in front of the rating agencies, and working together successfully defended our AAA bond rating. The reason that those rating agencies affirm the AAA is because of a huge surplus that has been here in the county, but also because they believe that we're working together. So I'd be happy to address any specific issues when this item comes up, but I would love to get an explanation of what is so secretive about this that me and my professional staff can't be notified about it. Is this kindergarten or is this county government? Thank you.
Thank you. Any other public comment? Seeing none, public comment is closed. Communications, I need a motion to receive and file the communications. Commissioner Long, supported by Commissioner McGilvray. Any discussion on communications? Seeing none, let all those in favor say aye.
Aye.
Anybody opposed, say nay. Motion carries. Regular agenda item. Treasurer's Office request for approval of amendments to subleases with the City of Keego Harbor, City of Oak Park, and Oakland Community Health Network. I need a motion, please. Commissioner Colwell with Commissioner Long supporting. Thank you.
Hi, good morning.
Good morning.
So I think the last finance meeting, we were here and requested a resolution for refunding of building authority bonds. This is kind of a follow-up to that resolution. We need to amend the contracts that are subleases to those that are affected by the refunding of those borrowings. So it's basically that simple.
Are there
So there's
any-
three, yeah, it's Keego Harbor, Oak Park, and Community Health Network, which has a new name,
Yeah.
right? So we'll update that.
Any questions? Seeing none, let's call the roll.
Markham,
Yes.
Middleton,
Yes.
Woodward,
Yes.
McGillivray,
Yes.
Quarles?
Yeah.
Quarles?
Yeah.
Okay. Howell,
Yes.
Long,
Yes.
Cowell,
Yes.
Zach?
Yes. Motion carries. Next item is the Health and Human Services Health Division Fiscal Year 2020 Sub-Recipient Agreement between Oakland County and Oakland Livingston Human Service Agency for Women, Infant, and Children Services. I need a motion, please. Commissioner Markham with Commissioner McGillivray supporting. Welcome Kathy Forsley, our head of our health department.
Good morning. This is basically a housekeeping item. The state has asked us to change this contract, this WIC contract with OSA, to indicate that instead of saying that a contractor, they're a subrecipient. That is the whole reason for this change. This funding is the same, nothing's changed, it's just the different
A typo or
Yeah.
a word.
word, yeah.
Okay, any questions? Seeing none, let's call the roll, please.
Middleton,
Yes.
Woodward,
Yes.
McGillivray,
Yes.
Quarles,
Yes.
Howell,
Yes.
Long,
Yes.
Cowell? Yes. Markham,
Yes.
Zach?
Yes. Motion carries.
Would you like me to do the coronavirus now,
Yes.
or? Okay.
Okay, we're going to have as part of this health item, a quick update about the coronavirus with, does that sound good, everybody?
Yeah.
Okay.
Okay, so as I'm hoping all of you have heard, we've had our first case identified here in Oakland County, and also there's a case in Wayne as well. Just so that you know, we're partially activating the EOC, which we intended to do with the identification of the first case, because this helps us tremendously with cross sectors. It improves our communication, and it's a sort of a repository of sorts to collect whatever needs are being identified in the community. It's actually going to be helpful in taking some of the burden off of the health division, so that all of these calls and questions could be logged over at the EOC, and then we'll meet at least daily over there to do a briefing and hear what the needs are and assign tasks accordingly. So that's a really good thing, and that's happening today. We really need to
So,
really focus.
I think most people know the emergency operating center.
Sorry.
So,
Yes,
but we do have
emergency-
some new members here, so.
I'm sorry, you're right.
Is there a phone number that we can, for the EOC, that we can give to people, or do you not want us to do that?
It's 248.
The Emergency Operations Center's phone number is 248-858-5300.
So yes, the EOC is the Emergency Operations Center. It's within the Division of Homeland Security, which is within the Department of Health and Human Services. And the manager of that, who you've probably seen before this committee many times, no, it's not what I mean. Yes, the manager is Tom Hardesty. I was expecting him here today, but you're filling in.
Yes,
Okay.
he was on a call with
Okay.
Region 2 North.
All right, so I was gonna introduce him, but Tom Hardesty. Anyway, so that is being activated today. This is the time for us to really remind people to utilize the resources that we have on our website at ogov/health, where we have a coronavirus page, and we're updating. This is rapidly evolving, and we're updating it pretty much daily. We have on there toolkits for various sectors, including healthcare providers, schools and childcare, businesses, general public, faith-based, first responders, food service workers, and senior centers. So each toolkit includes a letter to that service provider in that sector, and within that letter are links to interim guidance by the CDC specifically for that sector, in addition to many other pages that we've created to help them get messaging out and even things like cleaning, things they might not think about. That's going to be very important going forward as part of the prevention messaging. So,
Sorry, Kathy, can you encourage the commissioners to actually go to that website?
yeah, that,
and
please do.
download it and share it with those constituents?
Would love to see you share that link with as many as you can. So, in order to prevent the spread of coronavirus, or at least slow it down, we do not have a vaccine, of course. That will be many, many months out. So, the best tools we have in public health are the ones we need to utilize now. So these are things like stay at home when you're sick. Do not be around other people when you're ill, and when you recognize someone is ill in your presence, you really need to practice social distancing of at least 6 feet apart. And be creative with your thoughts. This morning I walked in and we were passing around a clipboard with a single pen. Well, we should be carrying our own pens with us, and we should not be using community things when we can avoid it. So things like that.
You're all gonna get it in, I named a pen, I can carry with you, no one touches it.
With a big fuzzy ball on it that nobody else wants.
Different colors for everybody,
Yeah.
21 different colors.
Right. So, but even, even the clipboard itself, we need to think about what are the creative ways we can capture the same things we want to capture without doing that. So stay at home when you're sick, but also we really need to heed the advice to stock up on things so that you could stay home for a couple of weeks. So you may find yourself in a situation where you may have to quarantine for 14 days because you were exposed to someone with an identified case of coronavirus. Well, we don't want you stopping at the store on the way home. Just go home and use the supplies you have. Same with when you find out you're coming down with something. You wake up some morning, I'm sick. Also, we don't want you in the store if we can avoid it. So it's really important to stock up on those supplies and have them on hand for when you need to be at home. Wash your hands frequently. One of the things that we're probably all could use a lot more work on, thinking about what you've handled, what you've touched, and always before you eat, wash your hands, wash your hands, wash your hands. We will be placing more and more sanitizers and tissues around meeting rooms and public-facing counters throughout the county. But you should always know that using a hand sanitizer is really nowhere near as good as washing your hands. When you wash your hands with soap and warm water, the soap has a surfactant in it, so that when you are rubbing your hands and the soap all over your hands and then rinsing it with water, it's all sliding off. When you use a hand sanitizer, it's a whole different principle. The idea is that it's killing what's on your hands, but we also know that it doesn't kill everything. So it's good when you have nothing else, but nothing takes the place of hand washing. So wash your hands frequently. Social distancing, as I said, is at least 6 feet apart whenever you can achieve that. Avoid close contact with those who are sick. Utilize the toolkits. Watch our website frequently because you're going to see more and more information uploaded onto that website. As I said, it's a rapidly evolving situation, and so our website will reflect that. And I also have here Melanie Grund from the Executive Office, and she is going to let you know about a stakeholder meeting on Friday.
Hi, morning. You should have all received, probably Monday, I think, an email from Ashley that sent you this invitation that went out to near on 225 stakeholders across sectors, the sectors that Kathy identified for the toolkits. We're bringing them together at OCC for a morning session, generic. Everybody gets sort of this kind of information, and then we'll break them out into sessions by sector. So food service won't be with healthcare, won't be with education, et cetera.
Right.
And then Kathy's team will be leading sections to give them more pointed things to consider and things like pens. I hadn't thought of that, actually. I do travel with my own pen, but.
Good.
So that's happening at OCC. Like I said, I think you received the email. I did bring hard copies for you as well. 9 to 11-ish, or 11:30, I guess, for the breakout sessions. So we just wanted to make sure you had seen it. If you hadn't, if it went into spam or whatever, and I will leave these copies for all of you.
And you should also know that this doesn't mean necessarily that we're inviting everyone we think is in that sector. We're inviting representatives that have good communication with that sector, because we couldn't possibly get them all under one roof. But you should also know that we're also planning additional meetings with other sectors. We, right on the heels of this, will be meeting with long-term cares, but not just the skilled living, the independent living, the assisted living, memory care, and senior community centers. Anything and everything to do with senior. We'll be doing that next. And then there'll be others along the way,
An example of what she means is we're inviting the superintendents of the school districts,
but not all the.
but not all the principals, et cetera, because they will then disseminate that information as they're the decision makers in their community.
Yeah.
Are there any questions about coronavirus right now, Commissioner Long?
Okay, so that is perfect that you're inviting the school. So you're saying for them to stay home, you know, when they're sick. So if you can work with Oakland schools to get rid of the perfect attendance awards, that would be good. They're going to school sick.
Very good point, yes.
And also when my son had the flu, I kept him home 5 days. Then we got a letter, your son missed so much school. I'm like, I excused him for the flu. So we've got to get over that right now. I think the schools definitely need to be talked to, because my son said that everyone's, you know, there's some kids that have perfect attendance in 8th grade and then they get a award. So they're
Yes.
coming to school coughing. And so if you can work with Oakland schools and get rid of that award for this year, that would probably help a lot for parents to keep their kids home.
And the same for employers too.
Right. Yeah, the attendance thing's a big thing
That
right
is
now.
definitely something that's on our,
Yeah, so
agenda.
like if they're there Friday, they'll start passing the word along to the school administration, so.
Yeah, that'd
Thank
be-
you.
yes.
Mine do not have perfect attendance, so I'm not worried about it. I keep mine home when they're sick and they go on vacation during school. Yeah.
Good job.
Mine do not.
Commissioner Kowal.
Thank you very much. I understand the governor last night issued a state of emergency in Michigan, which I guess some might see as a bit extreme, but I believe it probably brings into play a lot of other things that you can't do otherwise. So maybe you'd like to touch upon that. And then just in addition to the things that you said you wanted to change around here, we need waste baskets either in the bathroom where you can throw you can open up the handle, the door and get, you know, and anything that you don't have to touch. I mean, you go to different bathrooms, I've been staying there sometimes with my hands out waiting for the water to come on and thinking, oh, I have to turn it on, you know? So it's all different in every situation.
It is.
But maybe if we have, because I always try to get the hand towel first before I wash my hands, but if they can be just so where you just can pick them up, just little things like that. But let's get back to the whole state of emergency thing, if you don't mind.
Well, do you wanna speak to that at all, or that's why we need Tom here, maybe?
Yeah, I mean, we're still looking into it, so this would be under, I think, PA 360,
Yeah.
I believe, emergency, so it's not a, kind of FEMA, you know,
Right.
emergency kind of act.
Right.
Uh,
So when governors across the nation are starting to declare states of emergency, it's really also a flag to the nation about what is going on internally in the state of in the states. Yes, we've identified cases and now we're opening our EOC, which the state has done. But I guess it was a partial activation, but it's really raising the flag that, okay, we're in response mode now. They're also going to be collecting a lot of information from that point forward of costs that may be occurring due to their response to that. So if they don't start documenting that and that, you know, saying that this is now a state of emergency, really starts the clock on that, which we will be doing the same in our partial activation and documenting and then opening that EOC as now a place where all the counties can funnel in their needs, their communication. It's really just activating, it's a response mechanism.
Can you say where in Oakland County this was, we can't, okay. Thank you.
Commissioner Woodward.
Thank you, Madam Chair. I think there deserves and, I mean, should be, have confidence not only in the team that's been put in place, so not only the task force that was assembled to respond and help coordinate communication between sectors and everything, but the incredible leadership that your department led with the measles outbreak. And, this is how, from a public health perspective, how we respond. And so I want to commend you and, Kathy and the entire team,
Great team.
of being very proactive, as best we possibly can, and the board providing you the resources to be able to do that. And Commissioner, kind of tagging on to Commissioner Colwell's question on state of emergency, does partial activation of the Emergency Operations Center, I don't know what's the trigger for declaring a state of a county state of emergency, how that relates in general when they've been declared. You potentially are eligible for some additional funding to help support things if existing funds are exhausted. Does this apply at all in here? So,
Well,
as
we
it relates
also
to this.
believe that there will be additional funding that is coming through, and just by starting to log this to a specific project number, which we'll be capturing in the EOC, will allow us to use those funds. In terms of talking about state of emergency funds, I would believe that we would be exhausting these other funds first when those do come through before we would utilize that, but that requires the county executive to declare that a state of emergency. We don't believe we're there yet, but we do believe that this is time to begin to exercise all that we would be doing. It's just partial activation, we aren't gonna be there 24/7.
Right.
When we have a state of emergency, we likely
We would be,
Would
right,
be.
right. And related to that, I'm reviewing, the legislature is, I think it went through the House yesterday actually, and it looks like it looks positive in the Senate. The supplemental appropriation is moving through, in which there's a sizable appropriation for helping communities prepare for coronavirus. So I think that's great. The other thing, and I think we've talked about this before as well, is that this is, the way to protect ourselves, and I think we all have a responsibility to do our part to
Right.
not protect ourselves, but in doing so, we help protect exposure to most vulnerable populations, which have already been identified. But it's your basic things, hand washing, coughing into your elbow and not into your hands. Things that my wife is on patrol in the entire house, like elbow, hand, not hands. And particularly on restaurants, and I've talked to some folks in your office, I think the toolkit is great for our food service individuals. Is I'm to ask, is the sample signage, I think frankly at this point, it was only a matter of time since it would arrive here. Can we, is the signage available for restaurants to place all throughout the bathrooms and the inside door stalls, above urinals, what have you, just as a constant reminder, these are things that you need to do. It's kind of disturbing on how we have to tell people to wash their hands. Please do not cough into someone else's face and things like that. But I think this is also an opportunity, given what's happened. People are losing their mind, and there's a lot of fear, and I get that. And so so to the extent that we can be proactive in doing that, I know I've talked to my restaurant association in my district, the leadership there, and they're all in. Is there ways that we can, they're trying to figure out how to get hand sanitizer, more of their, spaces, because it's hard to get right now. And so I guess in terms of the signage and the stuff that we can put out there, one good thing is that our department gets inside every restaurant minimum twice a year, that we can help do that. And I guess I can't see why anyone would not want to, but do we have to take any additional steps to say, oh, by the way, under these circumstances, you are required to put this signage in the following places, to make certain that we put that information front and center in front of folks. And so I don't know, if there's thoughts around that. I'm all consumed because I just get yelled about washing my hands in my own house every single day. And so
Yeah, we do, definitely are gearing up for all of that, the signage needs, but we can't begin to satisfy all of the signage needs for the community, which is why we are putting in the toolkits, things that, signage that can be blown up to different sizes according to their needs, so that they have that capability as well. People aren't shy about telling us what they need too, so if, you know, if there's a specific need that we can answer, we certainly will. But signage is important, you're right, the best thing we can do to calm people that are feeling panicky is letting them know that they do possess the tools to make a difference. And giving that feeling of power and control over what's happening to them should be helpful.
And then my last question, so someone contacts the department and says, hey, I think I have coronavirus, I need to be tested. What happens? I only asked this question because I got a dozen of those questions yesterday from different sources.
Right.
This is gonna come up, and I've heard the national stuff, we have a shortage of tests, there's all sorts of the federal inaction, slow reaction, whatever. Okay, we have a case here now.
Right,
This question's gonna come more and more.
right.
What happens?
So
What's
this
the-
guidance continually changes from the state and the CDC depending on what you're seeing in your community. People, right now, physicians, hospitals, have to call the health division to get a PUI number, person under investigation number. And that is basically giving them the approval that their sample can be sent to the state for testing. And, but that, you know, is about to probably evolve and change as the commercial testing capability expands in our own community. But as of right now, we're still providing those approvals. We have sent 70 to the state to date. 35 are determined not to have the virus, and 34 are pending, and 1 is positive. So that's the way it is right now. But, you know, even that process has changed multiple times in the last few days about who is going to be approved and who is not approved. But, you know, once you start to have a case in the community, that's really going to open the potential for testing. It's no longer going to be confined to if you've had travel and that kind of thing.
Can they call the nurse on call?
Yeah, and we're encouraging to use the nurse on call. Nurse on call will determine, we used to give out the communicable disease number for our unit directly. We're not doing that anymore because they are inundated with calls, and they're on the phone literally 24/7 with all our hospitals and various providers. So we would like you to really try to get people to channel through their questions through Nurse on Call.
Is there a phone number for that?
Yes, it's 8. This is terrible. 248-858-5533 is the number, but I know there's an 800 number.
I think it's on the website.
Yeah, it's on, definitely
So
on
we'll
the
get-
website. The one page I didn't bring.
800-848-5533.
Oh, so it's the same thing,
What is
okay.
It's the same number, 800,
Yeah,
wait,
Thank you.
848
yep,
5533.
33.
Got it.
848 or 858?
48.
848.
I know that's confusing, everyone has trouble with that.
Are there any other questions, Commissioner Powell?
So, I just got kind of lost. Was there a clear answer as to who they are to be referred to? The
Nurse
health
on call.
division? If a person
Nurse
feel
on
they are,
call.
call the nurse on call?
Yeah.
Okay, thank you.
Yep, that's several nurses that staff that. So, you know, we have a phone bank, you know, it just, you know, it keeps expanding out to the next nurse as it gets busy. We're gonna have to pay close attention to it and probably move some nurses into that area, just as we're giving some other nurses some just-in-time training right now to be able to help us with trace back. That's one of the things we do when we get a case. We trace back to see what other exposures there might be with that person. And that's a pretty involved process, so we'll be bringing some more nurses into that team to have more capacity and capability.
Thank you. Are there any other questions? I do want to make one comment about the shopping issue, is that there are home delivery programs. You know, so that people don't have to be crazy, but Meijer's, a lot of the big stores locally, Kroger, Target, have delivery services as well as people want to use
For sure.
Amazon. So, yeah, so there are, we're
Yeah.
not in this, you know, if you're some remote place, you know, within Oakland County, we have resources
We're going
for
to have to
food
rely
delivery.
on the fact that they need to stay home when they're sick too.
Well, that's exactly- I
I
know.
understand that, but
Well,
just there are
right.
some different alternatives.
Right,
too.
no, and on that point, and like, this is like, cause that was like my first response, like, well, I mean, we've been moving this direction, but the reality is that the gig economy, which these shoppers and Uber
Yeah.
drivers and Lyft drivers and all these other people, I think, if they don't work, they don't get paid.
We,
No one gets paid sick time, in that industry, largely they're independent contractors, and it's even more important, if you think about it, that they have to make certain that they're, washing hands and doing all the other things, because, they're accessing
sure.
people's homes and stuff,
Yeah.
and touching product and food.
And those
Credit
are
cards.
conversations that we intend to have at Friday in the breakout section,
great.
sections, because we know that every sector has its own unique challenges, and that, you know, restaurants, many of them don't have healthcare insurance or sick time. We need to really start talking about that. What does that mean? Because, you know, if a restaurant's identified as a place where a number of people got coronavirus, it's not just that restaurant that's impacted, it's the entire industry. So, and they're well aware of that. We've been through that with outbreaks. We've had that conversation many times, but we're gonna have it again.
thank you. Commissioner Powell.
Texting capabilities, will citizens have texting capability, or do we have a texting system set up? With
You
the
mean
nurse
with the,
on call?
there's, she has an email,
Just the email?
yeah.
Thank you.
We're trying to respond to the deaf community. Do they have
Yeah.
access to, you know, or translation services?
They do have that, yeah.
Okay, and does that include the deaf community as well?
I would have to follow up on that to find out. Yeah, I feel like it does too. Just don't know exactly what they have set up for it.
It's usually part of the phone translation
Translation
system, but
services,
it would be
yeah.
helpful if you would just
Yep.
look at that.
Can I recommend an agency that they can, kinda contact to see, maybe, or,
Please do.
Def Can?
Yeah, I feel like that we are already connected.
Well, I know that they have a contract with us, but
Yeah.
I know, I just want the conversation to be had so that we can have them on board too, maybe.
Well, one of our Elite 40 is the director of the deaf, hard of hearing, and deaf blind Department of Michigan Civil Rights. And I've invited her on Friday to help us see where
Oh,
we.
actually, I take that back. What's the lady name that work in Treasury? Mary. She's actually the, board chair of Def Can, and she works in the Treasury's office. So
Okay.
actually, y'all could just talk to her and she can help y'all with the
Okay.
Def Can piece. Thank you.
Thank you for the sensitivity. Any other coronavirus issues to be continued and involving, and I hope that everybody can make the time to come Friday morning and get additional information.
And
With
share,
that-
and share widely.
Right. With that,
Yeah.
we have item number 3, which is Health and Human Services Health Division, agreement between the County of Oakland and Honor Community Health for integrated health care.
Doesn't matter.
I need a motion, please, to move this. Commissioner Powell, supported by Commissioner Markham. And we do have something that you want to, that I would like to receive and file, which is the liability, a memo from Jody Hall regarding liability issues related to Honor Community Health Contract. Do I need a separate motion? I need a motion for that to receive and file this along with it, Commissioner Markham, with Commissioner Powell supporting.
Question.
And I need a voice vote for that memo. All those in favor, or any discussion on the memo? Okay, seeing no discussion, all those in favor of this memo, say aye. Anybody opposed, say nay. Okay, the memo is received, and now we are on the full item. And Kathy, can you introduce everybody that you have with you, please, or Deb, one of you?
Point of order,
Yes,
just the 10 o'clock, where is it at? The meeting on Friday, 10 o'clock.
it's at 9 o'clock, and it is at Oakland Community College in Royal Oak,
Okay.
which is on,
Oh, thank you, they got a
we'll
flyer.
pass that out.
Thank you,
and
thank
it's
you.
in the auditorium, the theater upstairs.
Okay, thank
It's the same room where we had,
The women's event.
yes.
Okay,
Okay,
thank you.
Very good. So I'm Kathy Forsley, Director of Health and Human Services, and I am very fortunate to have members of honor here today. And so we'll start with Debbie Brinson, and you can introduce your own staff. This is the CEO of Honor Community Health. And
Great. Good morning. I'm Debbie Brinson. I'm the CEO with Honor Community Health Center, and I do have our team here, our executive team, but I'm going to start with our board president, Philip Henry. Mr. Henry is our board president, who's also joining us. George Miller is also one of our board members, who's also joining us today. We have Cynthia Duncanson, who is our chief financial officer, and finally, Dr. Hamadi, who's our chief medical officer. So we really do appreciate having the opportunity to be here to talk about questions and talk about this great partnership that we have.
And then, of course, Jody Hall from Corporation Counsel. Okay. So thank you for having us here. We presented on Monday to Healthy Communities, and basically we've made a few adjustments, and we will be presenting nearly the same thing we presented then, but maybe a little bit more information that we have anticipated might be important to you. Together, we're going to give you information about the project, give you some background information that we think that supports the need for this proposal, the phases of the project, the startup costs, the plan for sustainability, and we'll also be happy to answer your questions about the project overall. So, I want to go back to why did we start talking about this? And for years, we have been hearing, past several years, hearing more and more and more from our nurses in the clinics that they're spending a great amount of time with our clients, who not about the things that necessarily that they came to be tested for or treated for, but all kinds of things come out during the examination, things that really are barriers to their health, and they need help, they don't know what to do about it. We may give them referrals, but they may not have the ability to follow up on referrals. So kinds of things we're hearing about is their need for primary care, their need for mental health assistance, also some of them having immediate crises with substance use. They have expressed a need for jobs, better jobs to provide for their households, and also looking for training. Food, they've talked about a lack of food in their households. Many of them have expressed issues with not feeling safe in their home environment, or feeling like they will not have that, maybe 30 days from now will not have that home. So they were looking for affordable housing, others talking about transportation needs, and quite a few expressing really a lot of difficulty paying their utility bills. So when we dig deeper, the Health Division, as part of our ECHO initiative, our community assessments, is always looking at the health of our community in a variety of ways. I'm going to show you a few maps that also support the need for integrated services at the health division. So this map is a census map that tells us a little bit about health outcomes. Overall, we score really well on a lot of assessments for the health in our community, but when you dig into census tract information or specific populations, we find a very different story filled with disparity. And this map will tell us that there are census tracts in Pontiac that only have a life expectancy of 66 years of age. In Southfield, there are census tracts where the life expectancy is 72 years of age. And then, about 10 miles away in Troy, there are census tracts that have a life expectancy as much as 86 years of age. So that's a great disparity of 14 to 20 years just within 10 miles of each other. But it's totally a social determinants of health issue, which will make more sense as I describe the program that we have out, that we want to outline for you, why that's important information. This map is the health professional shortage area that's been identified for primary care. And as you can see, our offices in Pontiac and Southfield are within those areas. It also includes areas outside of Southfield in that southern tier, southeastern tier, that is always an area that we have identified as more high risk. Approximately 95,515 people live in these areas that have been identified as shortage areas that are low income, and we know that they will have more difficulty finding a provider because they have insurances that they may have difficulty finding a provider that will provide services to them. This map is the same kind of map, but it's for mental health. And as you can see, it's very similar to the primary care shortage area. So with maybe some differences around Troy. Next, I would like to tell you that we have nearly 250,000 people in Oakland County that are either uninsured, so just over 59,000 people are uninsured, 126,000 plus on Medicaid, and 42,000 plus individuals have enrolled in health insurance marketplace. All three of these types of insurance or non-insurance may increase difficulty for care. So what we would like to propose to you is a new endeavor that really builds on long-standing partnerships with Honor Community Health. Who we don't have here today is OLSA is a committed partner in this as well, who is really interested in providing navigators on site to connect people to services that will support them through their social determinants of health needs, that both the health division and Honor Community Health would take great advantage of. So this project that we have outlined for Honor Community Health to provide services under the same roof as the health division is a 3 or 4 phase project. The first phase that would start within about 3 months after, if we receive approval from the Board of Commissioners. The first phase being one where we would co-locate within our existing clinic rooms and really work alongside each other. We consider phase 1 to be a learning phase where we learn how to provide services in a seamless fashion, both in Honor's medical care as well as with the health division services and the community services that we have, and also with OLSA as well. We feel that phase 1 will take approximately 10 months to a year, but that's fully dependent upon what will happen in phase 1. It will be a simultaneous build out of 2 locations, one in Southfield, one in Pontiac, under our roof to build clinic space, actual clinic space for Honor. So once that's completed and a certificate of occupancy is obtained and Honor is moved in, then phase 2 would begin. But in phase 1, Honor will take a full-time professional health team and split it between Southfield and Pontiac and divide their time between those locations, being present in both offices, and also will bring in their mobile dental unit 1 day a week in each office, and Title X services 1 day a week in each office. So then in phase 2, when they have their own space, there will be an incremental, expansion of services to fill out that space and provide more space and some behavioral health services as well. And we feel that over a 2.5-year period, Honor Community Health will implement an increasing array of healthcare services that will include primary care, women's health services, Title X, dental services, and behavioral health services. So, and also then with service area space available, also will have a greater presence in phase 2 as well. In phase 3 is a transitional phase into full sustainability, and Deb will speak to that in a minute. But this is a period where we will begin very strong evaluation work about what's working, what needs shifting, what other partners do we need to bring in to fill gaps so that people can accomplish as much as possible within one visit. We will implement cross-agency data sharing to learn about our effectiveness and opportunities for improvement moving forward. We will learn also more about what neighborhoods, what areas in our county are really rising up to the top with high needs, where we can then turn this information over to our collaborations that are already working in the community. It will give them ammunition to go after funding for special projects that they can do to wrap their arms around neighborhoods to make them healthier, if you will. And we will work together with Honor and our partners throughout all phases to ensure that we are on the road of sustainability from day one moving forward, that we're tracking in that way. But again, Deb will speak to that in her area. As to the budget, there is a $4 million set aside that we're hoping to tap into. The construction of this has early estimates of $1.7 million for both offices reconstruction, but those are early estimates, and right now it's going through design, and also they're going out to bid. When that bid comes back, we will come back and request those funds, but with hard numbers. 2.3 million is what has been identified as Honor startup costs, which covers the cost of all the personnel, the equipment, and the supplies for until we get through phase 2 and into the transition phase for sustainability. That's spread across all of that time, and after that, it will be sustainable by Honor. Just to, I think that do you have any? No, I guess not. I will make sure that you have floor plans. This is south, yep.
Is that on the first floor or basement?
It's on the first floor.
Okay.
And if you notice, it's right inside the front door, right on your left where Parks currently is. So that and the sheriff and all of the things that are in that area will be relocated, and we will leave our Oakland County Health Division laboratory in that space, which may be useful to Honor as well down the road. And this will have 5 exam rooms built into that space. And the next one is north, and also right inside the front door to the left again, that whole first floor, left-hand side piece of our building is dedicated, would be dedicated to honor with 6 exam rooms and a blood draw area, a restroom, and a lab built into that area and a waiting room. So they will be very visible to the public as they come into our building. And I'm going to turn it over to Deb now to talk about the honor piece.
Good morning. I'm going to talk specifically about Honor Community Health Center and give you some background information. Just as our mission, we were established back in 2011 through a community collaboration, or 12, of which the county health department was actually a part of that membering collaboration. It was established to address a high need of 2 things, and you've heard one, which is the medically underserved area. That is one. And a HIPSA, a medical shortage area. And so people often say to me, medically underserved and medically shortage area, how can that be in Oakland County? And what happens is the state goes throughout the entire state. It looks at how many providers are available to serve Medicaid and Medicare and uninsured individuals. And believe it or not, in Oakland County, there is a particular area that has both a medically underserved and a medically shortage area, and that's Pontiac area. And you'll next question often get is, well, how can that be when there is McLaren, there's St. Joe's in here, Pontiac General, and the next level that the state takes a look at is, while there's providers in there, are they willing to see that population? And based on their data, whatever that is, and they collecting that, they determine that there is not enough providers in the Pontiac, greater Pontiac area to see the population in Pontiac. The next piece of that is then we're taking a look at medically underserved populations. And the Pontiac community is a medically underserved population. The great thing about this designation is that that population can move all around to Oakland County. And so it brings resources to all of Oakland County. So I wanted to talk to you a little bit about that. Just a couple things. I talked to you who we are. But we are an entity because we are funded by the federal government. We're an entity that has to see anybody that walks through the doors. So very much like a hospital that receives emergency services or funding from the state, reimbursement from Medicaid or Medicare, you can never be turned away from the ER room piece. And it's the same thing here. Once I accept that designation and those funds coming in, I cannot turn anybody away from walking through the door on that. But here's the piece, and I hope you don't mind. I like to stand because I like to kind of show. This is really an important piece, and this is the crux of why I think the partnership wanted to take a look at, and why I think it's really important here in Oakland County and all the work we do, is that in 2015, we said we have to become a federally qualified FQHC. And FQHC, that allows us to bill for additional funding to serving the community. It also allows us to provide a much broader array of services through grant dollars that become available that are just for FQHCs. So, an FQHC is a community health center. So you're going to hear me say that back and forth. What's unique about it is this enhanced Medicaid reimbursement. So I'm going to talk to you about that. That's what's going to lead to helping with sustainability. And we've done this now for a while. Who governs an FQHC? So I come out of Ingham County. I come out of the health department in Ingham County. They created and became an FQHC. And so one of the things that happened was they had to create a separate board, a board of governors that oversaw the primary care services, because the requirement is that 51% of the board have to be consumers who are receiving the care of that. So you can imagine in Ingham County there was some friction at times. Board of directors, board of commissioners, and a board of directors who gets to hire the CEO of the healthcare services and sets the budget for that. Many other communities, such as Denver and Pennsylvania, are looking at a model similar. Yours is much more cohesive because you're taking a look at the health determinants pieces of this. I'm going to go on to the next slide here. This is where our sites are. Over the last 5 years, through partnerships, the board of directors have asked me to take our services or your services into the community. Many FQHCs and communities just stay within one location and make patients come into that location. This board has gone out where your most vulnerable populations are, or individuals who have the most chronic healthcare needs. And so this is a description of where we're at. Primary care, we bring behavioral health services right on. That is a cornerstone and hallmark stone. I was just talking with a provider this morning who said, I really can't address somebody's hypertension and obesity if they're depressed and they can't get out of bed. They go hand in hand on that. And so my behavioral health person becomes critical to the team and making things work to make sure that that patient stays healthy. We have dental services. We have a full dental clinic, but we also have mobile dentistry, and then we have a number of school-based health centers. So I wanted to show you the trend so you can see where we're going. Pieces. We started in 2012 with servicing 3,000 patients, and you'll see we steadily have grown over the last 5 years to back at the end of 2018, we're over 30,000 unduplicated patients. As we get more known in the community, as we're much more visible in the community, those numbers continue to grow, and they grow at a rate that we feel we can manage and we can sustain. And so that's important for you to understand. So when Kathy's talking, you have about 160,000 Medicaid and uninsured individuals throughout the county. Remember, we're only hitting 30,000 of those individuals. These are the visits, so you'll see this will become an important factor in the formula to sustainability. So I wanted to show that to you. Users, visits, and then payer mix. And that's an important piece for you to understand as commissioners in the community. We'll move on to the next one. Patient-centered medical home. So I'm set up differently than, let's say, Gary Bernstein's clinic or the Free Clinic in Ferndale. Important services. But I'm set up to be, or our team, we as a health entity, are set up to serve as the primary care family practice doc that you go to, or an OB that you go to, or an pediatrician. We're not set up to do urgent care, and that's it. So this is an important number that I'm always looking at, is how many visits am I coming in? So just like you go to your primary care doc, I go to my primary care doc. Some years it's 1, some years it's 3 visits pieces. That's a medical home piece of it. So the first thing I'm looking at sustainability is I want that to be 3.5 or higher, or 3 higher. I don't want it to be lower because I'm urgent care piece then. Then the world sees me as an urgent care. That doesn't help with the sustainability. PCMH certified. So you're going to hear there's 2 ways I do financing pieces. I'm going to bill for services. I'll get grant opportunities for very specialized services, but then I also obtain revenue based on my performance outcomes. So if I'm a patient-centered medical home certified, which our sites are, it makes us eligible for more dollars to come in when we are successfully hitting our measures, our outcome measures. Patient demographic, just important for you to kind of see who we are, what's the race, the gender, and the age. I'll move on to the next one. Patient payer mix. This is really, really important, so I want to stop here for a second so you understand where I come on doing my financing with our CFO, who keeps me honest, George and Philip, who I have to report to on a monthly basis to the board, and I have to report to HRSA on outcomes pieces. They flag stuff that they see that they don't like happening, so I have
HRSA, please.
HRSA is Health Resource Service Administration.
Thank you.
They are the big guys over in DC that oversee all of the healthcare services pieces. So thank you very much. I'm going to go back here for a second. Can I go back to this one? This one's really, really, really important, regardless if you were looking to do this kind of partnership or funder pieces, because this reflects what's happening in a community. So I want to share with you, this 56% is Medicaid. 56% at the end of 18 were documented patients and visits were Medicaid. Now remember what I said to you. We're an FQHC. I get an enhanced reimbursement rate that the health department doesn't get, that St. Joe's doesn't get, that McLaren doesn't get being a PCP, okay? They may get other rates, but they don't for a family practice. That's the reason why you're seeing a lot of the hospitals merging. They're moving to specialty care pieces, and here's the other reason why that's happening. Here's 16%. Guess what? 16% of our population right now in my little practice is Medicare patients. That is unheard of in an FQHC. The average is about 5%. When I first started here 5 years ago, it was 5%. 2 years ago it was 8%. It is 16% now. These two are my biggest funders, is between Medicaid and Medicare pieces. And why that's important is it tells me that we have got an older population remaining and living here in Oakland County. In Pontiac, in particular, we'll need to take a look at that. But for me, as an FQHC, why you want an FQHC in Oakland County is these two pieces right here. It's because I get the most reimbursement for servicing Medicaid individuals. Those dollars allow me to see uninsured. That is the reason why FQHC and CHC dollars are so competitive across the nation. You cannot get that designation unless you compete, you show the need for it, and more importantly, you show the consistency in being able to deliver those services. It is this formula right here that helps to lead to sustainability. Now, this 14% is really good too. You don't see that often in FQHCs, which tells me that our medical team, our providers have great rapports going on in the community because anybody walks through the door. I generally don't see commercial. Ingham doesn't see commercial at 14%. And when I mean commercial, Blue Cross Blue Shield coming in, Aetna's of the world, those, my insurance, probably your insurance, our kids' insurance, that is coming in. I'm billing out for those services, and generally they're higher, but not as high as my Medicaid. So my Medicaid rate is what allows me to see uninsured individual, just like schools, special education funding, same thing there. This 14% is self-pay, which is your uninsured individuals. It is this piece right here, these three, but predominantly these two, that makes sure that I have enough resource to see uninsured individuals. So I'm always looking at a community. What is the payer mix in a community? St. Joe's is doing that. McLaren is doing that. We just took over two of McLaren's Medicaid practices because they weren't making enough money to cover their costs in servicing the Medicaid population. And with value-based payments coming and getting ready for this Medicare population, hospitals and practices are shifting to Medicare patients and specialty because we're getting older, and in Oakland County is that population piece. All right, can I move on to the next one? Budget growth, this just kind of gives you an idea how we've steadily grown and we've thoughtfully grown. So as we see more patients and we're doing more sites, we are putting together budgets that lean and move to that sustainability. It is based on billable services. It is based on Medicaid and Medicare, and getting all of our sites in scope. Hey, remember what I said? The other piece is about quality indicators. So it's not just about providing the services, it's actually about the quality of services that we're meeting, that the physicians are doing. These are our quality indicators that we send out to the feds, and the reason we don't have 19s up yet is we just sent them last month. It goes through a very rigorous process that the feds have to go through, validate all of the data, and they have till the end of August to validate all of the data on that. So this is validated data based on information that is sent to the feds and reviewed with the state's demographic information. So as you can see, this is all good data. We're hitting right where the state is. In some cases, we're doing better. These are going to be the two that make your project here in Oakland County and in Southfield, prenatal care and access to care, really, really important. And I'll talk to you a little bit about that here in a minute. These are some of the awards. Like I said, we have eyes upon us looking at what we're doing. HRSA is reviewing the data all the time. We're reporting to the data all the time. So those are things that they tell us about that we're doing. This just gives you a snippet. So you're going to say to Kathy, how do you know that Deb is saying that this can be reliable or that this can be sustainable? And there are a couple of different ways that we'll give her the data on this to take a look at it. First, we're going to tell her which providers are credentialed. So we're going to get these two sites as an FQHC designated certified site. So you'll go out to the HRSA website. You'll get notices that say this address and this address are now federally qualified a community health center. That is a great thing. Communities want that. Detroit has that, Flint has that, Lansing has that, Traverse City has that. There are more than 100 FQHCs across the state in getting this. At one point when Pontiac General, when I first got here, was looking to close down its residency program and us as an FQHC in there, we had the hospitals in Detroit fighting over us to come in. And the board made a decision. We are not going into Detroit. We're not moving our operations. We've made a commitment to Oakland County constituents and residents on this. But here's what I'm looking at. I'm going to look at a practice, and I'm going to look. Remember what I'm saying? These two become really, really important pieces for me, and then this private piece in this. That is what's going to cover my cost right there. I'm at risk as the CEO, and the board is, and Cynthia comes in and says to me as the CFO, let's look at this piece of this, is that payer mix. I'm looking at that payer mix to make sure I've got the right balance to sustain it. That's the reason why I want Medicaid patients, where most practices don't want Medicaid patients or Medicare patients because they take longer and they don't make enough money or generate enough money. Here, that is an opportunity for us, much like a dish payment through the hospitals and the old hospital systems, much like special education payments for special ed students. There is additional payment for the additional services that you're providing. So, a couple things to keep in mind when Kathy and team came and presented and said, you know, we really would like to partner. This is something, George was the first person on my second day of the job here that I called and said, George, I'm new here. Give me the lay of the land. Tell me what I should be knowing. What population should I be servicing? How do we work collectively? Community health centers and public health are like this pieces. Their job is community health on it. So a couple things. Gerontology, we need to be prepared for that pieces of that. The senior population is increasing in this community, which brings a different set of services. So you'll see St. Joe's and McLaren's and everybody looking at those specialty services as they should. You know, I fell a couple of weeks ago. I hit that magic age of 55, and I fell a couple of weeks ago, and boy, did I hurt my shoulder. In a way that probably if I had fallen 10 years ago, I would have been like, yep, let's go play tennis. You know, now I'm thinking, I don't know if I'll ever play tennis again. But I need the specialists now to go in and see. And that's the reason why you're seeing more of the specialty. The other piece that you need to, why I think this is a really very thoughtful process here is this one. You can't not have a healthy young population in this community. You have got to have a balance. Your hospitals will struggle with it. Your employers will be. Any healthy organization in the healthcare has to have a balance between all of these different payers and the population. Gerontology is costing me a lot more going in for physical therapy and for that MRI than it is for me just to go in and get my PAP each year piece on that. But remember, your Medicaid population in the state of Michigan is 50% of all women childbearing age of women in Michigan are on Medicaid delivery. We see that similar here. We want to make sure that women and children in this community have access to prenatal care and are getting in. So it comes to my whole thing on Pontiac. When we talked about this, Pontiac has the third highest infant mortality rate in the state and the highest low birth rate in the state of Michigan. We need this population to be healthy and to remain in this community for the next 20 years so that you have a really healthy and vibrant community. And then the last thing, of course, I would be very remiss to say to you that there are individuals who need and make sure to have access to mental health services, that we have individuals in this community who need to have both mental health services and primary care services delivered together. Okay, so these are the matrices beyond. I want to give you the background of the sustainability pieces of this. First thing I'm going to do is put this into scope. If this is approved, the feds have to I have to submit an application to them saying, here's what we're looking to do, here's the breadth of services, here's our financial plan for sustainability on this, here's our staffing plan, here's the need of that. The feds then have 120 days or 90 days to approve that. Once it's approved, we have 120 days to be up and operational. Designating, credentialing our providers, we'll get them all credentialed with all the health plans, both commercial and Medicaid, everybody. We'll seek contracts with the health plans. We have contracts right now. We'll just add these to a site. Number of unduplicated users, first thing you're going to ask me. First thing is Deb, how many unduplicated users are you seeing here through these two sites? If I'm not showing steady growth, then you know I got a problem. And I'm going to be the first one to tell you that. Because George and Philip will make sure, and Cynthia. Steady use of increased of users. So when I do out, Commissioner, you're going to want to say, how many unduplicated users are you all seeing? And you're going to want to see me going up on that. Unduplicated users. So one person walking, every person that walks in for services, an individual and consumer, is an unduplicated user on that. And you want to see that. So I showed you how we went from 4,000 users up to 30,000 users. You want to see that curve going up, and you're going to want to see that curve going up at your two locations on that. Number of visits. So remember I said that 3.4 family medicine. Remember, we're the family practice docs. You all have family practice docs. You go to one. Either you love your doc or you don't like your doc, or you're like, okay, whatever. I love my doc, Dr. Wendy. I've seen Dr. Wendy for the last 25 years, and that woman knows more about me than probably my own husband knows about me. Piece on it. My husband has his own doc on it. The kids, we all have our doc that we go into and we talk, or nurse practitioner we go in and talk. This visit tells me if they're coming in for family practice care. Patient mix that we talked to you about, what is that patient mix? And the great thing I'll already tell you, Blue Cross Blue Shield has reached out to us. They heard about this project. They're interested in talking about ways that they might be able to support us in the work that we're doing at these two locations next year when their grants come out. We've begun talking with them on behavioral health. What is always interesting to me is that people tend to come out when they see great things happening to say, how can I help and be a part of that? So I do expect that we'll be going after grants. I do expect you to be asking us what other grant opportunities are there to serve your constituents. I think that is it. Oh, two, Ingham. Ingham is a modified version. You have a very wonderful, robust process here on this. And Denver took their entire healthcare system in Denver and converted it over to an FQHC 25 years ago on that. Pennsylvania is another one. Ohio has a couple of local health departments that have the same kind of thing, but all more around the women's health perspective on that. So, there you go.
So just to wrap it up, this is an initiative of partners, as we've talked about, the integration of public health services with medical services. You can't overstate the importance of that. When someone comes to Honor because they're going through prenatal services, well, we're going to be aligning them with public health nurses that are seeing them in their homes to make sure they're successful with that pregnancy, supplementing the work that's going on in their clinic. or we're attaching them to nurse-family partnerships, so the nurses are just working on all kinds of other things that will make the barriers for health not be the issue that it once was. So, and then bringing in OLSA is a tremendous opportunity with all the services that they can provide to support as well. Really wrapping their arms around that social determinants of health piece. But just as Deb said, Blue Cross Blue Shield has already expressed some interest. So have partners in the community. They are already talking with us. We've already talked with Common Ground. There's already things that just by virtue of Honor being in our clinics or having clinic space under our roof, you can assist Common Ground with some of the needs that they have. Being a close neighbor to them as well. We're also hearing from mental health providers who would like to be a part of that really warm handoff for long-term mental health services. So our community is very excited about it. They're expressing it to us. We've gotten a lot of calls since State of the County about it, and there's really great excitement everywhere. So I think that this really fills a void and will really make a difference in outcomes for health in this community overall.
With that, I have Commissioner Long for first question. Thank you.
Thank you for the excellent presentation. It's a lot for me to take in. That was a lot easier than trying to look on your website, seeing what you were doing and reading things. That was much better.
Good.
With you presenting it. So there was a couple things that came up.
Sure.
The, school based. Do you have physical offices in those schools?
We do.
Okay.
We do. So we have a nurse practitioner and a mental health provider in those schools.
Okay, that was one thing. And then maybe this is more for Kathy. So if we contract with, so it's a contract, obviously, right? And so if we contract with Honor Health, are we not contracting with Planned Parenthood then, or what are we doing? Because that would.
Those are two separate issues.
So we're still gonna, so we're gonna have a health, I mean, some of the services are gonna be overlapping. Do we
Right.
need both still?
Well, one is just a very short-term fix, and the other is a long-term solution.
What is our contract that we did with Planned Parenthood? I mean, did we have an ending date, or did we not start that yet?
We have not started it yet, but there will be an end date. It's a very short duration contract.
So this is more long-term?
Oh, yeah.
All right, and then since we're on finance, I didn't know, and this isn't going to be my deciding factor or anything, but what is, since we're putting the offices, what is our cost, or do we have an estimate our cost of renovation, reconstruction to make all those exam rooms and stuff? Because this is our finance, so we should have.
That's the one that's the early estimate is 1.7 million.
Okay.
But we'll see what the bids come back, and I think that there's strong belief that it will come in that area, possibly less.
Okay, and then it looked like, this campus was having more exam rooms, was that one, or did Southfield?
Southfield.
Yeah, Southfield had more exam rooms, I couldn't remember.
Oh, no, wait a minute, no, it's a six.
This one had six?
Six, and the other one is 5.
Because of the room, probably we have more room here,
Exactly.
correct?
Yeah, better configuration there.
Okay, I'm good for now, I'll let someone else ask a question, thank you.
Are there other questions here? Commissioner Quarles and then Commissioner Middleton.
Thank you, Madam Chair. I too really appreciate this presentation. Certainly informed me and educated me. You talk a lot about the services you're doing in Pontiac, and of course I'm from the south end of the county. And my question is about Royal Oak Township. I recognize, and I saw on one of your slides that you're doing something in Ferndale High School.
In the high school, we have a mental health provider in the high school. So some money became available through the state that just was available to those school-based health centers to put mental health individuals into schools, and we applied for Ferndale and received one of those. Yeah.
Any thought about doing any service in Royal Oak Township? I am going back a few years. There used to be a temporary health facility that would come to the township hall, maybe once or twice month to give services?
You know, I think that's gonna be one of the great benefits is we do have a mobile team or what we call a roving team. And so we can work with the health department to schedule those out. It's much like our mobile dentistry. So if we know that coming into a location for once or twice a month would be helpful to a community, particularly to hook them up to primary
Right.
care services, that's what we can do. And that's the kind of relationship where Kathy's team can walk over and say, hey, listen, we're hearing about this need there. Those are things that we can take a look at. And if we can't, I mean, that's often how the mobile dentistry was I think the first thing when I got on the board, they're like, we want a mobile unit for dentistry. I'm like, okay. And so our grants team went to bat to look for funding, and so last year. So as we hear those things, we'll be able to look for opportunities and try to seize on those opportunities collectively.
And we're constantly working on outreach efforts to areas of high
Always.
need or specific populations with specific needs. We respond to that, and so now we have another partner to bring along with us.
Thank you.
I want to address that issue about community needs. So I serve on the Energizing Communities for Healthy Oakland. We're going through a whole nother strategic plan. And 4 out of the 5 communities that I represent have many social determinants of health, including Royal Oak Township. And so our health department has been very active working with the seniors program there, bringing services into my communities. And now they will have some additional things to offer, potentially. So I'm very excited about that.
And
piece
also
addressing-
express their interest to join in those outreach efforts as well. And so it'll be 3 partners that will go out and do a lot of outreach work.
Okay, I have Commissioner Middleton next.
Yes, on the resolution on phase 2, that would come about after basically doctor's office is built in.
Correct.
And then on phase 2, it says HCH will ramp up primary care family planning service. Is that Planned Parenthood going to be part of this?
No. So family planning is actually women's health services. So where I have to go in for my annual PAP each year, I go in for that. If I need to have contraceptive services, my annual breast exam, that is what we mean by reproductive health services, which is women's health services.
Okay, but this says family planning service.
It's another, used interchangeably for
Yeah.
that kind of service. Same thing.
I'm just not comfortable with that.
Yeah, the scope of services is well-defined in the contract, and it is, all of the services that Title X would allow. Can you speak to those?
Yeah, so think about yourself or your daughter or your wife or sister, mom, whoever, and men. Title X is about men as well, going in for prostate exams and good health, heart care. It is going in for those things that are unique to us as either male or female or for that healthcare services. So it is breast exams, preconception counseling. We're really starting to move to really helping women think about that if you're going to become pregnant in the next year or 2, we want you to be thinking right now about how to take care of yourself physically. So it is those types of services. So contraceptive services, exams, mammograms, breast exams, testicular exams, prostate exams. Sorry, let me have the expert.
No, go ahead.
Doctor.
Pap smears and other things like that are part of the women's health or men's health as relevant.
Right, and we've defined it in the contract as being defined by Title X, and it also includes in the definition, family planning services as defined in this amendment do not include abortion.
Is this a federal program?
Yes.
Is it defined at the federal level by the current administration, by each administration that comes in? I mean, is it defined at the federal level? Like, we're not grabbing something and
No.
coming up with our own
Right.
definition. This is a federal program that is done every year
Yeah.
by each administration.
So let me tell you why I'm interested in Title X program. Since day one I got here, Title X is set up to provide healthcare, particularly access to contraceptive services. So birth control pills, for example, for individuals who don't have insurance piece. In those situations, two things happen. I gotta figure out a way when a woman comes in, and I am very passionate about this given what's happening in Pontiac. The best women's health strategy and partner strategy is to prevent an unwanted pregnancy, and that starts with access to contraceptive services. So the very first month, we did get a call from an obstetrician who's like, I have birth control that I can't give out to this. Can we make referrals over? Because I can't afford to keep them in my stock because I have to pay for them. And so that is the advantage of me becoming a Title X provider is I don't have to figure out collectively or creatively to put $5,000 aside for birth control pills or exams for PAPS or cervical cancer, all of those things for uninsured women. And that is a benefit of Title X.
And also the goal of Title X.
That's phase one.
Yeah.
I mean, that's explained in phase one.
Yep.
It's phase two is where I'm having that problem.
With having the title,
Which it says, family
Is it-
planning
Is he
services.
reading the
Will
resolution?
ramp up our primary care and family planning services that will add additional behavior. And I see that as Planned Parenthood.
oh,
No. It's, they'll have additional exam rooms to see more women, ramping up, that's what we mean by that, being able to have more services and more people implementing those services in those exam rooms.
So let me share an area. Remember I talked about the quality scores that we get paid for and we're looked at that says as a primary care provider. One of those is PAPS. PAPS and prostate screens. I get reviewed on whether or not a woman comes in for her PAPS on a regular routine. Now, I don't know about anybody else. A couple months ago, I'm in seeing Wendy, who I love, on something else, and she's like, "You have not had your annual PAP, Deb." And I'm like, "Yeah, I know, Wendy. I'll make the appointment." She's like, "No, you're not leaving today until you have your annual PAP because you haven't had it done in 3 years, and you, of all people, know that you cannot go that long on it." Now, does this sound familiar to anybody? Okay. All right, yeah. Well, your wives or significant others might complain about it. But that's our job as a primary care provider in women's health and reproductive. And we don't score the greatest in that. We want to create an environment where women feel really good about coming in and they know that we're paying attention to their unique healthcare needs, as well as men on that. And that is when you look at the partnership within the health department is women and children piece. So that's what family planning and really what it should be is women's health services.
Right.
Women's health services all across the board. Family planning, though, does mean, or Title X means we're servicing men. So you have an STI population that comes in here that does include men that come in and are tested for STIs. We want to talk to them about good health practices. What are they doing to come in as well? So it is this, and I'm so darn glad I am not a physician, because that is Dr. Hamadi's job to do that. But I want to make sure everybody understands the context, because you all, and if you're not getting these, shame on you, but you all are getting these services right now, family planning services, in the healthcare that you're getting from your docs or your nurse practitioner or whatever.
Okay, I have Commissioner Kowal and then Commissioner Woodward.
Thank you, Madam Chair, and thank you. You are so enthusiastic, and you know this inside out,
I do.
backwards, and forwards. Honor is very, very fortunate to have you and the other members
We have
here
a great team.
as well. I wish that, I guess, all these discussions have been going on apparently for years,
Yeah.
but we've not been privy to them. So, I talked with our, former board chair for 8 years, and he said he was never brought in on any discussions. It might have been going on the other side of the street, but, so the first we saw of it when it became part of our year-end budget and amendments. So, so I'm going from a heck no to working my way towards a yes. You continue to make the case. I also understand, well, just touch on the base of the family planning thing again, that there's actually no referrals for abortion as well currently, so I'm good with that. My problem is, I guess, I'm okay, I guess we're gonna spend some taxpayer money to get you up and going.
Yeah.
But, the future's uncertain and things change, and I need to know that, I mean, we do little projects and then we do huge projects. This has come under a huge initiative here. And it has to be sustainable going forward. I wanna make sure that at no point that Oakland County taxpayers are holding the bag for this. And, right now, there's no language in this resolution, we have what we call a Gosling amendment, for our grant process, that if a grant goes away, the position and all associated costs go away.
Sure.
So that way we're not growing county government, because grants are like addictive. So, I just need to know that there's a backstop here, that if someday, because the playing field of all the medical things going on is changing all the time. So, I just would feel a lot more comfortable having some language like that in there. And probably there's a few other concerns that, I think we can probably address next, week in our, before the board meeting.
Okay,
So I'm almost there,
okay.
but just not quite just yet.
Sure, and I want to appreciate, first of all, I take full responsibility for the discussions before here. George, as I said, was the first person I talked to when I got here, just because of my public health background, and over the years, he had a very strong interest in discussion. I am the one that has said, George, I can't do that. We don't have the bandwidth. Let me get my feet more strongly on the ground for discussions. McLaren reached out to us and began. It just did not make economical sense and energy-wise to do that. So please understand, it was me that said to this health department and its administration, I can't do it. And I think that should say to you, my team will say they love me, but there's a side to me that they hate. And I'm betting that hate might be a little bit strong, but might be like a look of like, oh my God, don't go do this piece on it, slow down. And it's not on this one. If I had come to them and said, we're doing McLaren and we're doing this and we're doing all, they would have been like, no. So please understand that those conversations didn't go anyplace because of me. We're in a different spot right now. And the timing of it was perfect because I had been over to Kathy and saying, listen, I am struggling as a public health official looking at this infant mortality rate and low birth rate piece. We have to figure out how to do this, and I'm not sure. So understand me coming in, and then when you look at where you need to be in 20 years, you've got to have healthy moms. That is going to be instrumental to the overall place of Oakland County for our kids and our grandkids on it. You have got to have that balance. So please, I want to say that.
Well, and if I may, while it wasn't labeled to do a health center the way that it's being defined now, those conversations with both the previous county executive and the board chair had gone on. Deb and I had taken the board chair out to lunch to say, these are the things that need to take place into the future. This cohabitating together is something that's going to happen. We can't just have these services out in the community all over the place. It's just not feasible to offer good care. I've talked to you in the past about food deserts and the concern that we have in those communities where there's not the appropriate food that's in there. Well, it's a medical desert for some things too, because although people will tell you that they'll take Medicaid patients as a provider, they're not getting the rate enough to make it worthwhile for them. The fact that the federal government has come up with this enhanced rate, we can't fight that, whether we like it or not. That's what's transpired, and that's why as we started to develop this back in 2011, we were adamant that we had to ramp it up to become a full-fledged FQHC in order to secure that. And when we actually looked for an executive director in 2014-15 that could help us do that, we were adamant about going after Deb Brinson and bringing her over to Oakland County, even though she was tied to the Ingham County area. I think the other thing that hasn't been pointed out here is that there has been other instances during my tenure when I was in Kathy's seat where we did away with some services because we weren't the best person to be providing those services. You know, we got out of the breast cancer detection business because we couldn't keep up with technology and others in the community could do that. We got out of the dental business because we couldn't keep dentists and we couldn't keep our costs down. I was coming to you all the time saying I had to have more money to run that, and it didn't make sense for us to do it. So we went out into the community and did contracts to do that. And then finally, the medical care facility. It was costing you $2 million a year to run a facility that we just couldn't keep staffing and we couldn't keep up with what was going on. We ended up transferring that and the Medicare patients to a private provider without the blink of an eye, saving the taxpayers dollars. This is in the same realm of that. The health division can't find Dr. Hamadi's. Dr. Hamadi is sitting over here very quietly, but I think you need to know who this man is. He's a highly sought after physician who is award-winning, I'm getting choked up. I talk about Dr. Hamadi. But he is an award-winning physician, and more important than that, he could be in the private practice himself making lots of money, but he sees his commitment to the community of what he is doing. He is also very sought after for the fact that he is an educator and someone who runs a residency program that is highly sought after. And that's where the cost savings come in for this whole partnership that's about to take place, is we're using residents, training people in the community to then make them good physicians as they go forward into their own practices, hopefully reminding them whence they came from. And so I think it's important to know that the team that you have been given here is ideal. And while we maybe didn't label this 5 years ago as it taking over the health division services, it was always talked about in conjunction with community mental health. It was always talked about in conjunction with these medical deserts that exist, that we need to provide what is the best thing that can happen for our community. The other thing is the coronavirus should give you a pure demonstration of what the health department is good at and what they should be doing. They need to rally these troops to get people to realize, don't panic, you've got things you can do. And we need to get those messages out. We need to have those meetings where we can discuss that with professionals so that their time on epidemiological investigations is more important than offering a shot that it can be done by others in the community, and allowing a clinic to come in so that these families don't have to go from one location to another location to another location to receive a variety of services. And that's what's happening right now. Again, like it or not, the federal government has established medical homes, and you can't be a medical home as a health department because we're not getting that enhanced rate. They're gonna have to keep coming back to you for more and more money to hire more and more physicians and people to be able to staff that. It doesn't make sense. And I think the protection it does have, Commissioner Kowal, is you do have a do not exceed clause in there.
Yes.
And so with that do not exceed clause, it's like the Gosling Amendment. They're not going to get any more money. They can come back to you and talk to you about it, but unless they've got a great rationale, you're probably not going to give that to them.
You still have the floor.
Thank you very much, and that also clarifies a lot, and I just want to say too that, obviously, there's a lot of planning that has to go into this before you can even present it to us. If you presented some half-baked plan, then you'd be really, yeah. So I understand that, and I totally appreciate that you've obviously put a lot of time and effort and planning and resources into this endeavor. So I want to make it sound like, well, I'm just whining because I didn't kind of know about it, but you've presented a great plan, and
We appreciate that.
that's.
Thank you.
I didn't want to make
very
it sound like that. It's just like,
Right.
for
Yeah.
some of us, it takes us a little bit longer to kind of wrap our heads around it. Okay.
much. Appreciate it. One thing I want to remind you, we are not taking over the health department. There is no way ever that will happen. You have one of the best health departments in the state. This just brings more resources to them, but more importantly, more coordinated and warm handoffs with constituents that you see. So I wanted to make sure that's not happening here.
I have Commissioner Woodward, and then I have Commissioner Powell.
I'll let Commissioner Powell.
Okay.
So real quick, I just wanted to let my colleagues know that Honor Health Center has been a great instrumental, great
Partner.
instrumental clinic in our community. Like they said, I think they started off with like 4,000 people. Now we at about 30.
Yeah.
And just to know some of the disparities that my community face, a lot of these services are a high demand need. And I strongly encourage you all to vote yes for this. And also, I just wanted to tell you, they do have phenomenal dental services because I am one of their patients. And I just want to say thank you for
You're
the
welcome.
presentation today, and I hope that all my colleagues do support it. Thank you.
Commissioner Woodward?
Great. And thank you for an incredible presentation. Building off of George Miller's comments, I mean, I think this very much is an evolution. I mean, it's responding to how the healthcare system exists, particularly the public health care providing aspect exists, and put forth a long-term plan that yields improved health outcomes, which is really what we're talking about.
Right.
And I think there's a long tradition. A lot of my colleagues, I mean, on this board know that I've been a huge advocate for dental. I mean, to the point people have asked me to stop talking about it. Deb and I've had lots of conversations about it. This is like the beginning to be able to build on that, and it's so important. But also like figure out how the funding stream works, and it's innovative. It leverages the long-term funding stream. What I would like submit to finance and to, I mean, frankly, all commissioners, that we also have a responsibility. And I think there's been a lot of talk, like Kathy and Deb and the team will we'll be looking at costs and looking at all this, and that's absolutely true. But I think it's important for all of us to be engaged and make sure, like, okay, we're moving our way towards self-sufficiency and bringing in family planning into these clinics. I mean, while family planning Title $10 from the feds does not pay for the cost of Title X service,
Right.
it does bring revenue into the system,
Correct.
particularly so that we ensure that we fund those uninsured individuals. And so I mean, we collectively, not only just through our budget process, but I mean, ongoing way, and probably from a quarterly or at least biannually report, like, this is where we are, this is the status of things, and update, because so it's not a surprise.
Right.
So when we get 4 years, it's
Right.
not like, it's not self-sustainable. Federal laws and policy can change. I mean, this is a response to the funding structure and how healthcare is delivered, and a combination of best practices, and us constantly trying to zero in and trying to hit the health outcome goals that we're talking about. And I think this does it. I have a lot of confidence in it. I think it builds on a long tradition. We do have the best health department in Michigan, and this partnership is gonna really allow us to take our health service to a population who needs it, to improve health status, so that we all benefit from it. And so I support it 100%, and thank you for all the work that I know the board on Honor Health, the staff at the current staff and former staff, that this is really a culmination. I'm sure what I'm saying is very important. But this is a culmination of a lot of work of a team of people, and frankly, long-term leadership in this county that cares about improving health status, and this is what brings us here today, so happy to support.
And I just wanted to respond to that too, to let you know that reporting has been built into the contract. So we will have quarterly reporting and annual financial reporting that we will definitely be sharing.
I want to say thank you. I think this is so creative. Been hearing about it. You know, it's something makes so much sense. Some of the numbers, I am personally really dismayed how many people don't have access to care. When I look at those numbers, don't have insurance or the availability of treatment resources in our county. Now I understand why Fern Care is so successful on the south end, because there are so many people that need us. So I appreciate it. I have been advised by my analyst here that we do need to amend this resolution, okay? And I want to refer everybody so you can see what we're going to do. At the bottom of the first page, there is a be it further resolved that the fiscal year 2020 through fiscal year 2022 budgets are amended as follows. I want to amend and take this out of it? Or
Just the fiscal year 2022.
just the 22? Okay. And I'm going to have Michael explain this.
So the way that this reads is that you're gonna be appropriating $2.3 million each and every year for fiscal year 20, 21,
yeah.
22. And it's just for this year. So the budget amendment would only have to read fiscal year 20 to actually appropriate those funds into the health department's budget for contracted services.
I have my,
So I just wanted to correct, so we asked for it to be broken out by year, and I think it was difficult to say how much was gonna be covered in 20, 21, 22. So that's why they did it as comprehensive, and they should have just labeled it as 20 instead, and it would be spread out that 2.3 million over the 3 years.
But we'll appropriate all
Otherwise,
at
it would be in
once.
20, and it can be carried forward into 21 and
Okay.
22.
thank you.
Do we need a motion for that?
Yes, I do need,
Let me see, there might be some other language
Well,
that we want, but
okay.
in any case.
okay, right now, I need a motion for that change, and I need support. Commissioner Woodward, supported by Commissioner Powell. Okay, any discussion on that language change?
Okay, so that's taken out the words FY 2022 in the S at the end of budget, so, because we're only talking about one budget then rather than the two budgets. Is that correct?
Correct.
I would say is amended.
Yes.
Would do.
Okay, and Commissioner Woodward?
So just to be clear, so we set $4 million total in fund balance. This is the Honor Health Partnership, 2-point-something million that we are appropriating that full amount that will be available for a contract with Honor Health through the course of this program, which we hope to be then self-sustaining after that. Now, we might not use all that money, I mean, in this current fiscal year, but we are appropriating the dollar to be available for that contract. And later, once we get the bids and everything on the facility, the build-out costs, that will be a separate action that comes through here that will be pulled from the same $4 million reserve that we identified end of last year. That's, so the amendment appropriates the whole thing, so we can do this, and is capped at that amount. Okay, I'm clear. Thank you.
Okay, any other discussion to the amendment? Do we need to call roll? Okay, we're going to call the roll for the amendment.
Okay, Quarles,
Yes.
Powell,
Yes.
Long,
Yes.
Cowell,
Yes.
Markham,
Yes.
Middleton,
Yes.
Woodward,
Yes.
McGilvray,
Yes.
Zach,
Yes. Motion carries. Now, back to the original amendment as, the resolution as amended. Did you have something you?
Well, I was wondering if we could just take a brief recess.
Okay. 5-minute recess? Okay.
Yes.
Okay, we're going to have up to a 5-minute recess.
oversight.
Okay, thank you.
Let me add to that. So during the recess, Jody Hall, our corporation counsel, has the contract that she is discussing with our partners. And in that, they have a payment schedule. It's not firm yet. And so this is the opportunity to see that contract with the payment schedule to ensure that we are not exceeding the appropriated amount.
Appreciate it, thank you.
Did I do a good job?
Yes.
Okay.
Thank you.
Okay, do you have another comment, or
Is the discussion on it? Has it been
on
moved?
discussion on the amendment?
Yes. So
Commissioner Woodward.
as you've heard me all say, and I think this board has leaned into greater, transparency, oversight on a host of things that we're going to talk about again in a moment. Support this. I guess my question is, does this yield a bipartisan support for this proposal moving forward?
I mean, it does.
For me, it does.
There, I'm good.
Okay, let's call the roll on the amendment.
I'll shut up. It's great. Okay.
Yes. Vaughn?
Yes.
Cowell?
Yes.
Markham? Yes. Middleton?
Yes.
Woodward?
Yes.
McGillivray?
Yes.
Quarles? Yes. Zach?
Yes,
Motion carried.
motion carries on the amendment. Now, we're back to the original resolution as amended. So any further discussion? Commissioner Quarles.
Thank you. Just a quick question. With the change in the resolution with this amendment, does that mean that the committee with the oversight of the department will no longer see or have any of the questions or documents come before it again?
My understanding is that this would come to the Healthy Community Committee as it's rolling out, and we're going to see the fiscal piece, the contract, as it's going. That's my understanding.
In finance?
In
Yes.
finance, because we've requested that.
You say, although they,
They're the,
If-
you're saying that, they're the liaison committee.
yeah.
Yeah.
So
Oh.
it is gonna go to the lead committee? Because as I'm looking at it with that
Okay.
scratched
I know
out.
what she's saying, is the information still gonna go to Healthy Communities?
Yeah.
I think yes,
How
and the
about-
contract's
Yeah,
going here.
why don't,
Yeah, we could do both.
If
See, I would have thought it would have been easy just to add that, leave it as it was and just add on the finance committee for review and approval. But I'm not gonna split hairs today.
if I may, suggest on that, because similar, some questions I know that were raised by Commissioner Kokendorfer similarly around some of these issues. And so if the committee, Commissioner Kokendorfer, who sits on that committee, and the committee chair,
You could just interrupt for a second. The policy that the board adopted on review of contracts has a policy procedure set up for review of contracts to come to the finance committee.
That's fine.
Right.
So
We'll-
that's,
we'll
this
just give it to
amendment is
everyone.
consistent with that.
With that policy.
procedure.
Yeah, well, that's good.
If members of that committee for this particular thing,
Can
because
get
this is arguably the largest expansion of healthcare that we've had, we can amend that on the floor to include another
Okay.
committee if we wanted to.
If
But
you'd like it to be received and filed by the Healthy Community.
Well,
That's
yeah,
what
if we need to amend, we can do that on the floor. It's already gonna be on the regular agenda, if that's what the members of that committee would like, so. I'm comfortable supporting, moving
Well,
forward with
I
this.
would like to see it received and filed, but.
Okay.
But,
Okay.
no, that's okay.
You want to amend it?
No,
I'd
no,
su-
I don't wanna amend it.
Okay.
Okay. Back to,
Motion to reconsider if you want on the amendment, and then just,
We haven't voted yet, so it's still.
oh, they haven't voted, okay.
Well, yeah, we did. I'm sorry.
We voted on the amendment.
That's what I thought. So
You
you
can
have
make
a
a
motion to
second amendment.
reconsider.
How about
and then
this? Why
just
don't,
change it.
okay.
You could just
Why don't we
do
just add,
Or do that.
okay, yeah, so it's, another amendment for, for a receive and file component for Healthy Communities and Environment Committee. So I'll move that.
okay, we're taking we have another amendment. Please state it again.
Do we want to make it a separate be it further resolved? So be it further resolved that OCHD shall submit a copy of the agreement to the Healthy Communities and Environment to receive and file.
Let's just add it at the end of this sentence. second degree amendment.
Mine works too, but okay.
Okay.
I mean, that's
So
fine.
are
Either
we
way.
doing, wait, are we doing another amendment?
Let's do it as a second degree amendment to the First Amendment.
Well, is that
Okay.
okay with,
The only problem, okay, then I have to like change the way the sentence starts. Oh, okay, so it's sentence,
Just reread it, yeah.
okay, so just adding a sentence at the end of the amendment that was just adopted. Is it and or say, OCHD shall submit a copy of the agreement to the Healthy Communities Environment Committee to be received and filed.
wait, it's, are you okay, Commissioner Kowal, with that?
So this doesn't nullify what it's
It's
just
just
like,
adding
it's
receive and file.
another step that would be taken. Okay, I'm fine with
It's
that.
just adding receive and file, okay.
Do we have a
I'm
second?
going to, wait a second, I'm gonna let
For just that
Michael
committee.
Read it again.
Alright, so here's how
I
it would
think it would
read.
be further resolved, separate sentence would be better.
Let me just. And,
Yeah, just and
alright,
To be received and filed.
Yeah, I'd just do and. And.
alright, so here's how it would read, the entire thing, with the other amendment already in place. So be it further resolved that the OCHD shall submit a copy of the agreement to the Finance Committee for review and approval and Healthy Communities and Environment Committee to be received and filed.
Yeah, that's good.
Okay, so we've amended the amendment,
Well, I moved the.
or we moved it, so we need,
Second.
I need a second, Commissioner Kowal.
Okay.
And then we need another vote, okay?
Okay, Long,
Yes.
Cowell,
Yes.
Markham,
Yes.
Middleton,
Yes.
Woodward,
Yes.
McGillivray.
Yes.
Quarles,
Yes.
Powell,
Yes.
Zach,
Yes,
motion carried.
motion carries. Now, we are back to the original resolution as amended several times. Any other discussion? Seeing none, let's call the roll.
On the resolution as amended, Woodward,
Yes.
McGillivray,
Yes.
Quarles,
Yes.
Powell,
Yes.
Long,
Yes.
Cowell,
Yes.
Markham,
Yes.
Middleton,
No.
Zach.
Yes,
Okay, we have 8 yeas, 1 nay.
motion carries. Thank you.
Thank you very much.
Yeah.
Thank you.
Good job.
Thank you.
Good job.
Thank you.
I saw that, yeah.
You know, I'm not how to
Okay.
sit here with the with the sustainability discussion. If I'm still smiling, I mean.
Okay, we are now,
confident in those numbers.
you start to sweat.
That's right.
we're on item number 5. Oh, I'm sorry, we're on item number 4. Board of Commissioners, extension number 2 of deadlines for recommendations of the ad hoc committee on investment of public funds and reauthorization of the list of official depositories. Commissioner Woodward.
You want me to speak to it first, or you want me to move it?
Oh, I need a motion first.
I'll move it.
Moved by Commissioner Woodward, supported by Commissioner Markham.
So, this is 4. This is 4.
This is 5.
That's 5, yeah. So this is 4. So all this is the ad hoc committee has been meeting. Staff has diligently been working to bring forth recommendations. We need a little bit more time, and all this does is actually extend the timeline. And so we just introduced it at the last board meeting. So to go through the formal process instead of taking it up, so that if people have any questions. The previous one laid out a schedule for a recommendation, a report to finance and everything, and that's, because we need a little bit more time, that's why I wanted to come here to speak to it. And all it does is move it about another 30 days.
Thank you. Commissioner Middleton.
Yeah, I'd like to amend the resolution to change the word from April 29th to May 29th.
Is there support for that amendment? Is there support for that amendment?
I'll support it. No, I just want to hear
Okay.
why.
Okay, that was my question.
Okay,
Okay,
so,
talk about it, so we support.
please, okay, you've got support, discussion.
And the reason I'm making the resolution is because of the walk-on that the next one we're gonna take up is a walk-on, which we were just informed last night, and the Treasurer's Department, which is gonna, it's really affected them a lot, was just notified this morning. And with that quick of I mean, we've gotten hit with a lot of these things without a lot of communication and a lot of time to investigate. With what Andy spoke to us in the public section, I think he deserves the time to look at it and have more time. So I'm going to, and the next resolution,
That's what you're talking more about, the next one.
I'm going to amend that to refer it to the next meeting rather than to take it up today. So that's the reason I'm putting this amendment in, so that they have time to, that we can delay the item number 5 to the next meeting, so,
We're adding one more month.
yep.
It is, I mean, the
Commissioner-
29th versus the 31st?
May
Right.
29th's on a Friday, so.
Oh, okay.
Okay.
Okay, Commissioner Colwell.
Is this time sensitive in any way?
Well, I mean, if I can respond to that, Madam Chair. In terms of, I mean, the committee task in terms of approval for depositories, which is a board responsibility, I mean, it's time sensitive, we had to do it. We have money obviously in depositories. To any extent that we change that policy to be in accordance to what the board supports, we need to make, I mean, sooner rather than later. And so, I think when we started this process and working with staff, we thought we'd be done by now. It's like a lot of things, you start digging in, it's a little more complicated. The ad hoc committee is a bipartisan committee and has been working on it, will continue to work on it. So I'll be honest, like I am intent in trying to move through to get this done by April, but I mean, this is just, so we could bring it back sooner. So I don't have, if there's very strong feelings, we can extend it out. I would like to have the committee wrap up its work in the next month regardless.
Any other discussion? So let me clarify, Commissioner Woodward. Are you supportive of the extra time if you need it to support that amendment? Hopefully you can do the committee work before, but.
The main purpose of this resolution is that there were things that were pledged from the ad hoc committee to come to finance, like at this meeting. And so I'm fine with it, if it would make everyone happy.
Okay, so.
But, I mean, I just like full expectation, and we're not looking to
That is the
extend,
drop,
we're not
that
looking
is
to
the
extend
end
this to the.
date. That is the
right.
end date.
Okay.
Okay, so, any other discussion on this amendment?
We still on the first thing, right?
Okay, seeing none, let's call the roll on the amendment.
On the amendment, Markham,
Yes.
Middleton,
Yes.
Woodward,
Yes.
McGillivray,
Yes.
Quarles,
Yes.
Powell,
Yes.
Long,
Yes.
Colwell,
Yes.
Zach.
Yes. Motion carries. Now, we are back, the amendment, okay, we're back to the original resolution as amended. Is there any discussion on it? Seeing none, let's call, yes.
Which one is this?
This is number 4.
Number 4.
This is the investment policy.
No, this is the ad hoc committee extension of the debt,
Need more time to report
to
finance.
finish its work.
Yeah.
Okay, this,
It has nothing to do with this.
oh.
Nothing to do with it.
This is still item number 4, and we've
Okay,
just extended the timeline further. Okay, let's call the roll on the resolution as amended.
Colwell,
Yes.
Markham,
Yes.
Middleton,
Yes.
Woodward,
Yes.
McGillivray,
Yes.
Quarles,
Yes.
Powell,
Yes.
Long,
Yes.
Zach.
Yes. Motion carries. Okay, now we are on item number 5, which is Compliance Office Universal Administration of Procurement Policies and Procedures. Do I have a motion?
We got a new one,
Commissioner-
right?
Yes, this is the new one. Commissioner Woodward and support for this. I can support it, or
Yeah.
I'll support it. Okay. Commissioner Woodward is going to present it.
Sure. So this policy, I mean, and it's pretty short, is something that's it's intended to apply to all departments. It is perfectly in line with the transparency, best practices, and frankly, asserts alliance with the Government Finance Officers Association standards. And these are the standards at GFOA, is the standards that we apply to all of our budgeting and long-term planning and fiscal policy in the county, and has served us very well, and frankly, are the things that really deserve those practices are the things that have contributed greatly to the securing and the most recent maintaining of our bond rating, our AAA bond rating. Specifically, I think a little bit related to one of the earlier issues, this board has very much leaned into our constitutional statutory responsibility as it relates to oversight, whether it's been grant policy, IT contracts, overall contract approval, standards for purchasing, like the most recent responsible bidder and best value policy, that as a board, establishing those standards with the expectation that they are used uniformly and then brought forward to the board for consideration on those individual issues. So this is really about if public dollars are used in departments to help support things, to the extent that those things that are within our statutory and constitutional responsibility, that they should, that those standards should be applied to everybody. To some of the points that the treasurer addressed, I'd like to zero in on really three things. One, the ad hoc committee is currently working on some policy recommendation as it relates to depositories. That is a duty and responsibility of this board, and feel very strongly that we should do it. And that policy, I would expect to not only decide what firms that we put money in, but how we put those monies in those firms and the amounts that we put into each firm. That is an appropriate fiduciary responsibility as it relates of the board. That's a board power. The treasurer, without question, has also enumerated powers and responsibilities, and we need to work together to ensure the best management of these financial dollars. I mentioned the importance of GFOA, and that's, frankly, those standards are the ones that have governed our fiscal policy for as long as I've been on this board, and has served us very well. And so this policy actually builds on those recommendations from GFOA to ensure that, and again, if you look at the dark line of what this is supposed to be, is that there's going to be a universal standard of procurement policies in terms of a bid process, that it's not in any times a single individual, but anyone that has a fiduciary responsibility. Part of this is part of that selection process, and we just most recently undertook that with our bond counsel, undertook it with our financial advisor, and it has served well, and frankly should be applied to all standards, which is, I don't think anyone would disagree. I would say in practice that is uniformly, it's generally applied across departments, and there are some outliers in all of that, and this is just establishing a policy, like moving forward, that we're going to ensure that the procurement policies are uniform across. There's no question a procurement policy is a power that's held in the executive branch under our organization of government. Now, we as a board have the ability to establish policies and set policies, and we've helped modify and update those policies, working with the people who are tasked with overseeing that. And the last thing I would just mention, and the Treasury made reference to an award-winning policy, and I heard it. That policy is also under consideration for this board. It has not been adopted. There is existing policy in place in practice, and I fully expect that, there's definitely portions that will be adopted. It's the board's responsibility to adopt those policies. And so as it relates to, again, depository and any oversight responsibility that the board feels appropriate, that's the recommendation that I expect the bipartisan ad hoc committee to bring forward to the board for future consideration, which is related to the last issue that hopefully will be addressed in the next 30 days. So just to recap, all this is, and working with the administration to establish a universal administration of procurement policies across all operations. I would argue And this has been like some tension with the, I mentioned the pension board, that when we put things out to bid, those things should be done in accordance. And the way I look at it, if county dollars are being used to support staff, or of anything, that then the procurement policies that are best practices and have served us well should apply there as well. So, I think it's a pretty cut and dry. I don't think anyone disagrees that if we have a purchasing policy, we should be using it uniformly. I don't think anyone disagrees that our purchasing policy over the years has been very good. Those RFPs are publicly accessible, and that particularly things that directly relate to our authority and our responsibility, particularly when you just bring up depositories, because the treasurer brought that up, that we should be part of that process before making determinations on what depositories that we use.
Okay, I do have Commissioner Long and Powell, but I want to add to this. So one of our deputy county execs, Sean Carlson, unfortunately, he's not with us today. He had conflict of schedule. But one of his major areas of expertise are purchasing and procurement policies. And so really, this policy is coming from our new administration, looking at things that we're doing, and we've had a good, and making some suggestions after surveying what we're doing and improving upon what we've been doing, and building on best practice and policy. So this is really coming from the administration, taking a look at how can we be better at what we do, and recognizing it. It's not geared toward one office, it's saying everybody. And I serve on the retirement board, and we didn't do the best practice bidding, and it was brought to my attention by Deputy County Exec Sean Carlson that we should have done something differently, that would have been better practice. And so this is recognizing that we're moving into the best policy. So with that,
I can say the thing that this does, the only thing that this does is really add this darkened language here, which, very clearly says that the purchasing division shall be responsible for the procurement of all goods and services for all department heads, elected officers, appointees, and employees of Oakland County. The department heads, officers, appointees, and employees of Oakland County shall be subject to the policies and procedures contained herein, which is basically this section is the purchasing policy, as the Oakland County Purchasing Policies and Procedures Manual. The county shall not be responsible for the cost of goods and services ordered or purchased by any county official or employee that are not obtained in accordance with this policy. And contracts for goods and services negotiated outside this policy will be considered invalid and non-binding. And so, if we believe in transparency, if we believe in good government, if we believe that our purchasing policy is a good purchasing policy, then all this does is that everyone should follow those rules.
okay, so I have Commissioner Long and then Commissioner Powell.
All right, so Dave, so in the past, when our other, Pat Tohaney was our county treasurer for years, so he chose a depository, and it never came to the Board of Commissioners, or this is something different, so.
No, I think that because there are resolutions that would come forward.
They do come.
Yeah, they do, correct. And sometimes with broad authority, they capture any institution within the county and then leave it to the discretion. I'm not aware of setting a limit in one institution or another, which to me is a policy question that we should be having.
Credit unions.
Yeah.
I brought the, no, I
Okay,
brought
that's what it was.
I
So
brought
we
the
have-
resolution that
so
added
we-
credit unions to be allowed to be considered. But in terms of selecting, making changes and that long list of
List that we
things,
get.
we really didn't play any role. Now, I don't know why we didn't choose to, did we put most of our money, I can't remember going back that far, did we put were we just a handful of institutions and what they were? I know sometimes, you're trying to meet efficiency with oversight, right? And so I think you want criteria to allow in circumstances to be able to move things to protect our interests. And I think it was like, I perceived, I guess I don't wanna put like words in Dohany's mouth, but I would measure like broad authority to be able to make that, frankly, a lot more broad than when I talk to my colleagues in other counties. They're like, well, we actually are, we say that we'll do this, this, and this.
Okay, so I guess I remember we always approved their list of depositories, and then at one point you said, what about credit unions? So I remember all
And
that.
we added that, yeah.
So now the difference is with this resolution, that would come before us with their depositories or their suggestion, they would still have the authority to do that, and then we're gonna say how much money they can invest in it?
It's two separate issues.
This,
Okay.
okay, right now, before you is the procurement policy at adoption, saying that every level of government, every person has to follow these guidelines for going outside to contract for services.
Okay.
That's what we are discussing. The previous agenda item, number 4,
Okay,
is
that's different.
investment policy.
Okay.
And that is going to come
Out of
before
that.
us.
That's separate, right?
At
That's
a
why, that's why
future
they should be
date.
uncoupled, because this
Okay.
is
I-
separate.
So, and this is governing, I have heard, this is governing all of the elected officials,
Okay.
all of our departments, the retirement board, the drain board, it is universal acceptance of this suggestion, following government, GFOA.
Got it.
And our staff have looked at this, analyzing and saying, this is a good policy for us to go forward with.
Okay, I get it now, that other is the other issue
The
you're
other issue,
working on
that-
to
right.
make a policy
Which
for
a
that.
policy will come forward in which we'll deliberate, so it's like, that's not even related to, all this says is that a uniform procurement policy should be applied
For
across
all the
board,
departments.
For everything.
For everyone. Okay, thank you.
No, and the
Okay.
one that's currently in place, I mean, now you're talking about changing it. because
Got it,
the
thank
current
you.
one-
Okay, I have Commissioner Powell and then Middleton.
So, one of the things that I'm concerned about that our treasurer has expressed is that, the timing of him being informed. Just like any other director, any other department head, we allow them to see things so that they can have their own input in that. So, I think that we saying uniform for all the departments, then we need to be uniform and including every department head when addressing anything that's affecting their department. So I'm asking that we do allow extra time for our treasurer to review these documents and bring back opinion from him and any other department that may have an opinion in regards to this. So that we're respecting everybody's wishes, because I just think that's disrespectful, and I honestly, to be honest, I think that because we have the political BS going on, that may be one reason why he was not, addressed about this. And the reason why I'm saying that is because this is not the first time that the Treasurer's Office has been left out of something that we have to review. And I don't wanna see it continuing to happen with any of our department heads. We need to respect them, be it whatever the case may be, and stop with this political stuff. So that is my opinion on this, situation. And also, the only other thing that I will say that is, some of our departments I know have state statutes, and would this affect them in certain ways depending on the state statutes that govern them as far as how they have to process in their departments? So that would be a question to Meisner's, our treasurer's office, just to get clarity on that. But my request is, I'm agreeing with Middleton today, that we do respect and give, time for review. Thank you.
So I want to address that quickly. Yesterday, it was brought to my attention, late in the day, and I asked about the time sensitivity. And I agreed to put it on the agenda because the investment policy group coming before. And again, I'm all for good policy, so I agreed to put this here. So I'll take responsibility for the late notice of accepting it as a walk-on. So, are you making, are you done, Commissioner Powell?
Yes.
Okay, I'm gonna recognize Commissioner Middleton.
I'd like to move to postpone the resolution to the March 25th Finance Committee.
And do I have,
And I support
Okay, any discussion? Commissioner McGilvray.
I'm curious as to why County Treasurer Meisner was not involved in this.
I didn't,
Executive office not here to answer.
I don't know how to answer that because this is coming out of administration. I don't know if they were consulted or not, so I don't have an answer to that.
Yeah, I don't have an answer to, they're not here, I'll let them speak for themselves, but what I will say that, Act 139, purchasing is a responsibility that squarely falls within the jurisdiction of the executive office. And so, since that purchasing falls, in this case, under Deputy Executive Sean Carlson, and the reason the reason it's not here, at this moment, I understand he's at a procurement conference right now. And so to bring all this stuff to ensure that we have a working policy that ensures that we have uniform application of a policy that's already in place is why, why it's before us.
Okay, any other discussion? Yes.
Statutorily, it falls within the
Commissioner
executive
McGilvray, you
office.
still have the floor.
Just a comment, hearing that, I'm in favor of the motion to postpone. I think that we owe that courtesy to the county treasurer.
Any other discussion on the proposed amendment?
Motion.
Motion to postpone. Seeing none, let's call the roll.
To postpone, Middleton,
Yes.
Woodward,
Yes.
McGillivray,
Yes.
Quarles,
Yes.
Powell,
Yes.
Long,
Yes.
Cowell,
Yes.
Sean could
Markham?
be here then.
Yes.
Sean could be
Zach?
here then.
Yes. Motion carries.
Yeah,
And,
could we have Sean here too?
Well, too, please.
And
We'd
why don't-
probably be able to.
What? What?
No, I'm just.
Sean, yeah.
Yeah, I,
Sean here and then it would.
so,
And-
Chris
and
will
Madam
request.
Chair, certainly this will go to the Treasury Department and they will have their discussion and review on this.
Absolutely. Any other business to come before us? Seeing none, finances over at 12:10 PM.